Hi and welcome to the Daily Pashupati show. My name is Guru Pashupati. This is the show where I answer your questions on wellness, health and well-being. I'm doing a diabetes special where I've got 27 questions about diabetes which will cover every aspect of diabetes, and if you listen to all these answers, all these 27 answers, you'll feel well equipped to deal with diabetes. If someone in the family has it, or if you have it, or if you're at risk of it. Okay, so let's get started. The first question is, what is diabetes? And diabetes is or rather to have too much sugar in the blood, glucose specifically. Okay, so excess blood glucose as a chronic condition in your blood is called diabetes. That's it. So it's named by the symptom. It doesn't tell you anything about the causes of the disease. So if you get diagnosed with diabetes, understand you've not been diagnosed. They haven't told you what's wrong with you. They've only told you what's happening in you. That's it. That's not a diagnosis. A diagnosis has to tell you the cause. Okay, I even checked up the dictionary meaning just to be sure, because my whole life I've not got diagnosis. I've only got a restatement of the symptoms. Yeah, so diabetes as a word is quite useless. Let's go into it and understand it more deeply. What are the early signs and symptoms of diabetes, and what are pre-diabetic conditions? Okay, so what's the early signs and symptoms of diabetes? You can get low energy and you can get very angry, because when your blood sugar drops after it's gone high, then the insulin comes and packs it into your fat cells. Okay, so that's how when you get diabetes you start getting fatter, because the insulin is taking the sugar out, it's compressing them, making them into triglycerides and pushing it into your fat cells, and then you kind of have low blood sugar all of a sudden, and then you get cranky. So if you have crankiness and if you have problems with your eyes, it's gone really far then, because I know people who found out about diabetes after they went blind. And then you can have a lot of diabetic neuropathy, which means a lot of pains in your body, and you get exhausted very fast, you won't have any energy, and what else? You start getting infections, because all that excess glucose is feeding bacteria in your body, and the glucose itself is toxic to the body if it's there for too long, if it's not used as a fuel. It's a fuel, so it can burn, and it will burn up parts of your body. Okay, and that's how the neuropathies and other kind of retinopathies and all of that happen, because it's burning away parts of your body. So you can get various symptoms because of diabetes. Another one is that you will have interrupted sleep. It's called nocturia. Your sleep will be interrupted for you to urinate. You will have frequent urination, and you get thirsty very fast. Okay, if you're getting thirsty a lot, then you should probably get yourself checked for diabetes. All right. What are the causes of diabetes? This is my favorite question, because I myself had diabetes. I had something called 1.5, diabetes 1.5, which is called LADA, latent autoimmune diabetes in adults, where my immune system started attacking my pancreas, the islet cells to be specific, with islet cells antibodies, and I wasn't able to produce insulin as much as was required by my body, and I started having really high sugars, and I didn't know what to do. The doctors were advising me to inject myself with insulin, and I didn't want to do that. I wanted to find out what's the cause of it. So I'm going to tell you about the various causes of the 3 types of diabetes, and you'll find this very useful if you have diabetes, or if you know someone who has diabetes, or if you're at high risk for it because other people in your bloodline have got it. Okay, so the first type of diabetes, the type 1 diabetes, is also called juvenile diabetes because it's a congenital problem from when the child is born, it's not producing enough insulin because there's something wrong with the pancreas. Okay, the pancreas itself is either physically damaged or it's lacking some kind of cells to produce insulin. That's it. So then that person cannot produce insulin. They have to take injections for the rest of their life of insulin. And there are some really great doctors I know who run Understanding Diabetes. It's a website. If you search for it, you can find it. These guys are experts in dealing with all types of diabetes, but especially type 1, because they both are type 1 diabetics in the pink of their health, in their 40s now, and they're really doing great. They're living life to the fullest just by taking injections. So if you got type 1, you got to learn from these guys and just copy them and do exactly what they do. Yeah. So yeah, it's two guys called Robbie and Cyrus. So you should check it out. They're doctors. I think one of them is a doctor. I'm not sure if they're doctors or not, but they're effective. And type 2 diabetes is caused by two factors actually. Since I've treated a lot of patients, India is the diabetes capital, and in the last 5 years I must have treated over 200 patients and cured them of diabetes. So the second one has actually two causes. The first cause is intramyocellular fat. So inside your muscle a little fat is stored, which is called intramyocellular fat, and this is an emergency energy fuel which the muscle uses when it's out of glucose. So there's always a little fat there, but then because of eating the wrong kind of diet, the liver gets oversaturated, and first they get a fatty liver, and after that they get diabetes, where the fats start increasing inside the muscles. The muscles start taking up some fat, and then that kind of like a chewing gum in a keyhole, it goes and blocks the receptors from inside. So now when the insulin comes and sits, it can't really make contact, it can't send any molecules here because it's blocked by fat. And so the person's muscles become insulin resistant and reject all the glucose, which is then floating around in the body, causing symptoms of diabetes. So it's not like the person isn't producing insulin. They are. In fact, now they're producing excess insulin, which is making them fatter and fatter. So this is the type 2 diabetes, one of the causes. Another cause for excess sugar in the blood is that the liver dumps its glucose stores into the blood every time you have a stressful or fearful thought. A little bit of fear is enough, and in yoga there are 18 kinds of fears. A little bit of any one of the 18 kinds of fears will create a drop of sugar, big massive drop of glucose into your bloodstream by the liver. So the liver dumps its glucose into the bloodstream because it thinks you're afraid, so there's something to run away from, so let me pump this guy with energy, and the liver just pumps you with energy, with sugar. And then what happens? The blood glucose is always out of control because you're always having fearful thoughts, and this can only be cured by removing all those karmas that are causing those thoughts in the first place. So this is something that it can be beautifully done, and I teach it to all my yogis. So get in touch with me if you want to be a yogi and learn all these cool things. Okay. And the third type is, of course, type 1.5. That's what I got. It's when your autoimmune system, when your immune system starts attacking the pancreas. But even that is not a cause. Okay. Why did the immune system get crazy in the first place? Why is it going and attacking my own pancreas? After a lot of research and study, I found out that it's happening to me because there are some viruses which have taken refuge in my pancreas, and these immune cells are going and attacking them and destroying the cell to destroy the virus. So all autoimmune diseases are usually this. We haven't discovered this yet, okay? But it's a theory that I worked on, and I started getting results when I started treating the person for virus. When I put them on a diet that is antiviral, when I started giving them herbs that are antiviral, then they've got cured of autoimmune diseases. And the same thing I did for myself. I started taking antiviral adaptogens and herbs, and it got completely cured, and it's never come back again. Maybe some cells got destroyed, but I think they got rejuvenated, because this time's blood reports, I got a really good report card with regards to my diabetes. My HbA1c is 5.2. I've never seen this kind of numbers, and yeah, it's like a big transformation. Okay, HbA1c is an indicator of the average blood sugar you've had for the past 3 months. It shows how glycosylated your red blood cells are. That's why HbA1c. Is diabetes genetic is the next question, and this question is a very it shows a very commonly held belief that we can pass on diabetes. So usually, why children of some diabetic parents get diabetes is usually because they're all eating the same food and cooking the same way, and that's the reason that diabetes gets passed on, because you pass on our bad food habits to our kids. Okay, it is not genetic in any way. All right. So this is what you got to understand. So just because your parents got diabetes, you are at a higher risk if you eat the same food that they're eating. But if you change your food, listen, somebody put it very beautifully. They said, genes load the gun, but diet and exercise pulls the trigger, and lack of exercise pulls the trigger. Okay, so you have a loaded gun. If you don't pull the trigger, nobody dies. Same thing. If you have loaded genes that everyone in your family easily gets diabetes, that's okay. Don't pull the trigger then. Okay, don't eat wrong kinds of foods high in oil and fat. Avoid foods that are high in oil and fat. Everybody tells you to avoid foods that are high in sugar, which is true. Like avoiding carbohydrates is ridiculous, but you just got to avoid oil and fat, so then you won't inherit diabetes. Just try this. Cut out all the oil and fat from your diet, just like everything. Don't binge on nuts. You can have a little nuts, but don't binge on it, and then you'll see that your diabetes sugars are just coming down. Yeah, it starts healing itself, because then all the intramyocellular fat gets a chance to come out. The liver can now process it because you're not bombarding the liver with fat. Okay, so that can be completely reversed. That's the best part about diabetes. It can be completely reversed. So don't worry, if somebody in your family has diabetes, it's cool. You don't have to get it. Don't pull the trigger. Next, with what mindset do diabetic patients approach you? Okay, thanks for this question. People come to me when they're completely dejected and don't have any hope. That's very unfortunate, and that's why I'm making these videos. Come to me earlier. I can help you faster and better. But even if it's too late, according to the doctors, I pulled a lot of people out of the jaws of death by just practicing the art of removing their karmas. Look, karmas it's like a boat, Karmas are the cause and we see the effect. So if a boat has a hole in it, then water's coming through. The cause of the boat filling up with water is that there's a hole. But the effect is that there's water everywhere. So if you want to work on the effect, you take a bucket and start bailing out the water. But if you want to work on the cause, you have to plug the hole. Once you plug the hole, there'll still be some water in the boat. That you can take the bucket and throw out. Okay? So you've got to work on the causal body and the effectual body. Unfortunately, many medical practitioners have failed to work on the effectual body simply because they don't have the knowledge, because they're not yogis. Only yogis know how to work on the karmic bodies, but karana sharira, yeah. We don't even have this word in medicine, karana sharira. How many doctors have you gone to who said, oh, it's in your karana sharira, I can see your diabetes, let me take it out? Nobody, ever. Okay, this technique is only known by giri yogis, and for the first time I'm teaching it openly to to my students who want to be yogis and healers. So if you aspire to learn, do get in touch and I'll be happy to teach you these things. Okay, which organs does diabetes affect the most? Even before you got diabetes, and I assume you're talking about type 2 diabetes, it's the liver. The liver is the first one to fall, and then it starts affecting any organ. It depends which one gets infected first. It's just going to be a mela there. All sorts of stuff is going to happen inside. So you can't really say, but sometimes it's the intestine, sometimes it can be the heart, and sometimes it can be the eyes. These are the most common ones, and the nerves become victims of diabetes. Okay, so yeah, what's the difference between diabetes mellitus and diabetes insipidus? Diabetes mellitus is the common diabetes that we understand, having sugar in the body, but diabetes insipidus is urinating so much, excess, urinating a lot and then getting dehydrated and feeling thirsty and drinking a lot of water, and it's idiopathic, which means nobody knows why it's caused. But we do know. When we look at the blood report, there'll be reasons why it's caused. Okay, there will usually be some kind of toxicity inside the body. But we never screen such people for toxicity. We say we don't know why it is, but anyway take this medicine which won't help you, and we send them away. So that's not the way to treat it. But even diabetes insipidus can be treated. It's not as common as diabetes mellitus, but they're two different things. They don't have anything to do with each other. Okay, they just share the name diabetes. So I'm sure there's some historical reason for it, but I don't know it because I'm not a nerd. What is diabetic ketoacidosis? So ketoacidosis is when you kind of get low blood sugar, and then your body starts using ketones for energy instead of glucose, which leaves an acidic byproduct inside the body, and it makes acidosis inside the body. Okay, so that's diabetic ketoacidosis. It's a very painful condition which starts burning up your internal organs. And when you get low blood sugars, you have murderous moods. You want to murder someone. Okay, so you get really like angry and in really bad moods. So it's hell, in other words. Next question: can diabetics live a long life? Now, of course, when you cure them completely of diabetes, they live a long life. Okay, but as a diabetic, you can expect maybe 10 years or 15 years maximum. Maybe, okay, 10 years of okay living and then another 5 years of assisted living, because you'll be so sick and your kidneys will fail, by the way. Okay, your kidneys are very badly affected. We'll come to that. And so then if your kidney fails, then you'll die soon. Okay, so many people have died because of the burning away of the kidney, because it's processing all that sugar. And sugar is kind of acidic to the body. It burns it. It's a fuel. Okay. How do I get rid of diabetes? Is it curable? Yes, you can get rid of diabetes completely. It's curable. And there are many steps to healing it. And if you really are serious about it, get in touch with me and I'll help you. I promise you I'll help you get out of it. Because I've helped so many people now. More than 200 people. Okay, just get in touch. Yeah, it's definitely curable. You get rid of it by changing your diet and changing your lifestyle, and with no medication you can get over it. Okay, how to prevent diabetes? Take care of your nutrition and your exercise. Don't eat oily, fried, fatty food. That's it. Just take care and you'll never get diabetes. Alright? And why are the number of people with diabetes high in India? In India, it's mostly stress-related diabetes, where the liver is dumping sugar into the blood. I know this because I check people's insulin as well. And usually some of them have normal insulin, but they've got diabetes, severe diabetes. That means it's fasting insulin when I check, right? That gives you an indication whether insulin resistance is there or not. Because if insulin resistance is there, early in the morning, a lot of insulin will start being produced. They don't have insulin resistance. The insulin resistance starts after they see their spouse's face, and when they go to office, then their insulin resistance starts. It's not really insulin resistance, it's high sugars, because the liver is just dumping its sugar stores. They probably have fatty liver. So if you want to prevent diabetes, just follow a proper diet, just cut out all the oils and fats, keep it to a minimum, okay, and then work out. I have excellent classes where you can work out. As you can see behind me, there are these healing woods, okay, and it's through these healing woods that I create health in your body. By moving these pieces of wood around, you can work on almost any internal organ. You can change your body structure. You can make space for your internal organs to work. It's an amazing invention, and it's through this that I cure diabetes. So I give 4 months of my class for free to anybody who signs up as my patient, so that they can get these exercises that change their metabolism and then the way that they manage energy in their body. If you look at our diets, in general, Indian diets are okay, but now it's turned into some crazy thing, right? Punjabi food you get in a restaurant is not what they eat in Punjab, and it's just like the Chinese food you get in restaurants is not what Chinese people eat. So they don't use so much oil, but now restaurants are just like making things float in oil, and that's if you're having dishes floating in oil and eating out all the time. Eating out is a big pastime in India. So that's also another major reason for diabetes. And then we don't have a culture of exercise. So exercise is not encouraged. You have to study for engineering. So then nobody gets enough exercise, and then they start getting diabetes because nothing is breaking down all of the fat stored in the liver. All right. So the next question is that the most prevalent form of diabetes is type 2, and the cause of it is insulin resistance than production. In such a case, why do the doctors prescribe insulin stimulating medicine and insulin itself rather than addressing the cause of insulin resistance? I don't know, man. Ask the doctors. I've been asking them this for a long time. It's a good question. I've asked this to the doctors. They have no idea why they're doing it. They're just doing it because what else is there to do? We run out of things to do. This is the only thing to do. So let's do this thing. I know diabetologists who have diabetes. How's that for ethics? Okay. Anyway, it's crazy. Why is my sugar high and yet no symptoms of diabetes? Wait for it. It will come. Okay. Don't worry about it. Just wait. Or you could do something about it. Get in touch with me and I'll help you fix it. Okay. Don't wait. Don't wait. Don't wait. It's coming soon. My mom is diabetic and she's taking acarbose plus metformin and glimepiride in the morning and vidlagliptin and metformin in the night. Her postprandial blood sugar is a bit normal, ranging 130 to 160, but her fasting blood sugar is always ranging from 130 to 160, always. Is there anything that needs to be corrected? Yes, you need to fix the root cause of the problem, not just bail water out of the boat, but fix the leak. Okay, so you really need to figure out what's going on, why she has diabetes in the first place. And if you need a proper functional blood chemistry analysis, which will tell you the real cause of her diabetes, get in touch with me and I'll give you that analysis of her blood work. Okay. Yes, it needs to be corrected. You can't have someone living on all these medicines, you know, it's only going to toxify the liver even more, and then you'll get other symptoms, right? Like tumors or something serious, like thrombosis. Anything could happen. Side effects of the medication. Is proliferative diabetic retinopathy related to diabetes? Yes, it is. It's the excess sugar burning away nerves around the eye, so it affects person's vision. They can even lose their vision. Next question, does sugar cause diabetes? No, it doesn't. But white sugar, yeah. White sugar can cause diabetes if you eat a lot of it. Your sugar will be high, your sugar levels will be high. You stop eating the sweets, your sugar will come down. So it's not really diabetes. It can cause a false diabetic-like condition. But real diabetes is when people are eating a lot of fat. That's when they get real diabetes. I have low blood sugar levels sometimes. So am I having diabetes? Yes, you are. Because there's excess sugar in the body. Insulin is coming like an army and taking off all your sugar. And then you feel low blood sugar. Right? So that's definitely a symptom of type 2 diabetes. What is gestational diabetes? Gestational diabetes is a woman who discovers that she has diabetes only when she is pregnant. That's what it is. Okay? So she already has diabetes and then has the courage to go and have a child, and then she discovers that she's got diabetes. That's usually what happens. If you're in good health and you don't have diabetes, it's highly unlikely that you're going to get gestational diabetes. Okay, I know this from experience. I don't have any research to fall back upon, but I've been able to cure gestational diabetes because it's just type 2 diabetes. It's just another name given to diabetes that got discovered during the pregnancy blood test. Why do some people with diabetes develop kidney disease? For the same reason. Sugar is a fuel and the kidney is eliminating so much of it every day, and it reacts with the kidney and then it makes the kidney dysfunctional. Okay. Yeah. So how long does it take to heal diabetes? Depends on how bad it is. If it's really bad, a year. If it's not that bad, 6 months. That's when my company treats them, because we use proper methods which work. Okay. But otherwise, diabetes never gets cured. Never. If you start swallowing medicines, never. Okay. But even if you are swallowing medicines, I can help you to stop swallowing them slowly. It'll take a year. If you've already started swallowing medicines, it'll take a year. If you haven't started yet, then 6 months I can cure you. Next question is, does the ketogenic diet work on type 2 diabetes? My doctor strongly advises not to do it, but and instead do the plant-based diet. What do you think? Well, I think your doctor is right. Okay, the ketogenic diet is only going to add to the liver's fat load, and it's going to increase your diabetes on a long term. On a short term, it will reduce your sugars, but it's going to come back with a bang. Okay, it's going to really come back, and then it will also cause heart disease for you. Ketogenic diet is a diet for people who have epilepsy and seizures. They notice that these people are losing weight, and that was enough for these weight loss people to get on it and make it a big thing and then say this is the solution to you being fat. You're fat because you have diabetes, and then you take a ketogenic diet and you make the diabetes worse, and yes, you will lose some weight, but it all comes back. It all comes back. The moment you eat a little carbs, it will all come back. The weight will be back, the diabetes will be double as strong. So please follow your doctor's advice and eat a plant-based diet. Okay. Then what are the later health complications of having diabetes? Okay, renal failure, very obvious one, because your kidney is filtering out all that sugar, and that means kidney failure. And then you could have also, they say that you could have Alzheimer's because it wears away on the brain as well. The sugar is floating everywhere. Wherever it goes, it causes destruction. Retinopathy, which is loss of vision ultimately in one eye, and then blurring of vision. It gets worse. Pain can cause neuropathy, which is shifting pains all over the body. So all of these things can be, or even particular pain in particular places. Yeah. It can cause lots of complications, and all of them are fatal diseases, and then you'll die. Nobody dies of excess sugar in the blood, but they die because of what that excess sugar does. Can eating white rice up the risk of diabetes? So I've experimented with this, and like I said, it's not the carbohydrates that we got to run after, it's only the fats and the oils. It's okay to eat white rice, and you can still manage your diabetes. If you want to know how, get in touch with me. And why do kids get diabetes? Well, they have probably got juvenile diabetes, but I won't be surprised if I caught any random 10-year-old and tested him and he had high blood sugar. Take a guess why? Because of the wonderful diet that they're on nowadays. Everything comes in a packet, okay? No more mother's love, no more cooking. Everything is coming onto a packet. Take this packet, take that packet, take this packet, put it in water, boil it and eat that. This is how people are eating, and they think they know to cook. Shall I cook you a Maggie? God, that's not called cooking, that's called boiling. Okay, can I boil you some poison? Yeah? So if you're boiling up these poison and giving it to kids, mummy 2 minutes, and then finished. Your kid also will last for 2 more minutes, that's it. Okay? That's why children have diabetes, because parents are irresponsible. Is medication required to heal diabetes? No, not really, unless it's very severe. If your HbA1c is thumping over 8 or 11 or something like that, then yeah, you need some medication to manage it until we fix it. And when it's fixed, all of those numbers will fall down. Okay. So this brings us to the end of the diabetes special. I hope you enjoyed watching this series of videos, and I really appeal to you to reach out to me if you or anybody you love is suffering from diabetes. I will help you to figure out the root cause and then tell you exact solutions for that particular person and their temperament and all that. I'll also work on their karmic release, so that the real cause of the diabetes, which is invisible in the karana sharira or the karmic body, is taken away. Alright, so thank you very much for watching. If you liked it, then hit share and do subscribe to our channel.